Hello and welcome back to BeeWellwithMS Podcast. I'm your host, Dr. Agne Straukiene, neurologist. Today we are talking about the moment that is filled with loads of emotions. Usually when we talk about the progressive MS. To the point that a person with MS journey, when the disease-modifying therapies are being stopped, what's next? It can give you a lot of disappointment, a lot of disbelief that this is happening to me and I no longer have any effect from disease-modifying therapies. Or maybe I'm not an appropriate candidate for these treatments. Everything matters. For many, that moment feels like a cliff edge going downhill. But I want to encourage you, and I want to gently challenge this image. Because what I've seen over and over again, that it can also be a pivot point. When disease-modifying therapies stop, it doesn't mean that we stop treating MS. It means we shift our focus from inflammation to building resilience, from slowing relapses to supporting life. And from there, we built a new kind of care, a new model of care. So in this episode, I want to speak not just a clinician, but someone who sat in many of those hard conversations. I'll share how we navigate that transition, what support systems should be in place and can be in place, and practical ways to manage symptoms like fatigue, pain, mental health, anxiety, depression, mood changes. And I'll share some hope because there is still so much we can do for you. So tune in and listen to this episode. When someone reaches the stage where their MS is progressing despite treatment, it's easy to feel like something has failed, that you have failed. But that simply isn't truth. Progressive MS, whether through relapse-associated worsening, we call this RAW, or PIRA, progression independent to the relapses and activity, or smoldering MS. It's part of the natural course of the disease for many people, but not all of them. These terms are complex. They've always been. But what they really mean is that changes can still be happening, even quietly, silently, unseen, invisible, as we call. And while we might no longer target the immune system, we have a lot of opportunity to target you as a person, your goals, your function, your well-being. This is time for a care team to help you, not to step back, and certainly not to discharge you from the MS services. That's my opinion, and I'm going to advocate for this. So, here's what I believe should be part of every progressive MS care pathway and journey. Symptom-focused review at least once or twice a year. We need to regroup on your symptoms, go through the list. If you have certain measures at the clinic, score them. There are some patient-reported outcome measures. In the clinic, I do MS Pro Discuss assessment of the symptoms. And I give a score and I redo that assessment 6 months later, a year later, 2 years later. I keep track of that because I'm interested. I want to know where I can help you as neurologist. And you as a patient should track that too. I know journaling is not the best thing to do, but it's something that keeps the momentum. You can track and record and then see what there are potential triggers. And when did this start? When does it stop? All these things matter. Also, what's important is the neurorehabilitation. So physiotherapy, in other words. There are so many things online, private physios, NHS physios, in America's system, in Europe. You can sometimes self-refer to the service. And what you get is a tackled group of exercises for a certain group of muscles that can potentially improve your function. But it's you that is going to stick to the regime and follow the program. Without you, the physiotherapist is powerless. Okay, so also, what's your home environment? Can some appliances be fit in your house, in your flat, apartment, room, no matter where you live? That's occupational therapist assessment. And it's usual practice in UK. Also, if the speech and language is the problem, which usually is, a lot of people with progressive MS, if you haven't noticed, they have some facial weakness, bilateral facial weakness, which really changes how they speak. They become a bit slurry. Sometimes people have lesions affecting the posterior fossa at the back of their head and within the cerebellum and brainstem, and that causes a very specific slurred speech, like drunk speech in a way. So there are some strategies, diet, advice that people would normally get from the speech and language therapist, dietitian. And there are also cognitive challenges, as we all know, but use it or lose it. Do you stimulate your brain? Do you read? Do you listen? Do you watch? Do you maintain the conversations in public? Do you ring your best friend and have a chat on the regular basis? So these things matter because that's how you occupy your brain and allow your brain to function better. Now, there are some team members that could also support and help you. So one of them is MS specialist nurse, MS coordinators. These are your compass through services and emotional support. Okay, so you ring them. They may not respond within the minute you ring them, but they will in 24, 48 hours, in a week, in a 2 weeks' time. Their responsibilities are to talk to people and give them information and then discuss with their consultant, neurologist, or other specialists, or refer you to and signpost you to the relevant specialist. The other important aspect in your care pathway is your mental health. Okay, so if you are depressed, if you're anxious, if there are some other serious mental health illnesses, there is help. I know there are some waiting times to get to see the specialist, but the referral needs to be done first. Okay, so because mental health is MS health. The healthier you are mentally, the better the MS is going to be. Also, don't forget the power of the peer support, the connection, the social support, self-management groups, coffee groups, exercise groups, and various different charities and societies, non-profit organizations are organizing these events, whether face-to-face or online. That's a common, normal practice. Now, let's move and look at the practical tools that may enhance your journey. You may feel it's more meaningful and maybe even giving you inspiration. First thing, and the most common thing, is fatigue, tiredness, exhaustion. Fatigue is not simple tiredness. For people who don't have MS fatigue, I just want to explain that it's exhaustion after waking up. Walking to have a shower, people feel exhausted, drained. They can't function further. They need to pause, stop, regain their energy, and then go back to whatever they started. Why it happens is because of the nerve inefficiencies. As you know, demyelination slows down the signaling process and it impairs the energy throughout the body. Poor sleep, people not sleeping and they are exhausted. The heat summer is coming, it's there already. People don't sleep very well because they haven't got a cooling environment to fall asleep. Maybe some cooling mattresses could help, and quite often do. Also, stress and anxiety, thoughts and emotions. People dwell on what has happened to them. If they are too excited or they're too worried and sad, that all happens throughout the night. The thoughts coming and reverberating on multiple things, and that keeps people awake. And as a consequence, you haven't got energy throughout the day. So first thing that I ask people when they come to see me with any MS, progressive, relapsing, remitting, doesn't matter. I always ask, have you slept well? Do you sleep normally well? And this is where we start improving, and I very precise on it because I know that that's something that you could resolve very easily. Now, mood and emotions. So obviously there are so many different therapies, from mindfulness to cognitive behavior therapy, acceptance therapy, hypnotherapy, various different activities, and plus medication. So if somebody needs a medication, they need it. So serotonin needs to be replaced. And that happens when people not saying that I'm depressed. People who tend to say I'm depressed, they just probably have a low mood. But people who start stopping looking after themselves, they don't care how they look, what they ate, what they've done, when they stop being interested in your life. So these are sort of, and fatigue is another symptom of mental health, of depression quite often. So having an enhancer of the emotions and mood, whether that comes from interventions in therapy or medicine or combined approach, that could only improve your quality of life. Also, what could help everyone is pacing yourself. So people decide to do various different things and they just go and do things and then they can't wake up the following day because they overdone. They haven't paused, they haven't paced themselves. And it's important to break the big tasks into the smaller chunks of the tasks and rest before the exhaustion. You feel your tiredness comes in, you pause and rest. You don't go into sort of exhaustion and then rest. You have to feel and work with your body and identify the time when you're peaking up into exhaustion or when you're going downhill. Just before you're going downhill with energy, you then stop and pause because that's easier to replace and regenerate your energy levels. Keep cool, use the fans, cool showers, baths, very comfortable, breathable clothes because you don't want to sweat in the synthetic polyester clothes. So it needs to be natural fabric that keeps your body fresh and clean. Track your energy patterns. It's important to notice your peaks and dips and plan accordingly. Wind down, evening screen reduction, putting the phone down 2 hours before bedtime is super important. Watch TV in the daytime. Give it time for yourself to meditate, to listen to good music, maybe radio, read, just lay down in bed and dream about things or have a chat with your friend, ring a friend if you can. But try not to scroll and look on the media and stimulate your brain inappropriately. It doesn't give you any good night's sleep. Also, focus on good nutrition. Eat regularly, stay hydrated, avoid long gaps between the meals. If you start extending, I know some of you are on the intermittent diet. By this time, your body got used to that. It's not suiting everyone. You need to discover yourself. But with energy, you need regular, high nutrition dense food, not sugar, not even multiple times of the fruits or multiple fruits, because that gives you fructose, and fructose in the body becomes glucose, and glucose is our sugar. And you may experience a sugar crash. So sugar crash is not a good idea because it exhausts you further. So be mindful. A lot of people make mistakes. They say, oh, I eat a lot of vegetables and fruits, but actually 2 items of fruit a day is enough because otherwise you expose yourself with a lot of unnecessary sugar, and then sugar causes more exhaustion than before eating sugar, before exposing yourself with refined sugar or even fruit. Okay, so 2 items of fruit. Don't overdo with grapes. Grapes are full of fructose, and that could give you a sugar rush. So be mindful about this. Now, pain is another factor that is very debilitating and causes a lot of grief. According to Hippocratic Oath, we cannot disregard patients who suffer with pain. This is our mission, to help people with pain. So pain is a common symptom in MS, and there are different causes that causes pain in MS. So neuropathic pain is one of the commonest descriptions and problems because pain comes from the injured nerve. So it causes a lot of pain symptoms such as burning, stabbing, pinching, there are different descriptions to describe neuropathic pain. So there are some methods and interventions to address that. Neuropathic pain responds well to pregabalin, gabapentin, duloxetine, one of these agents. This is usually prescribed by family doctors, GP doctors, or neurologists. Also spasms and cramps, often in the legs and back and arms sometimes face. And what's most helpful, there are some agents that helps with the spasms, antispasmodic agents such as baclofen, tizanidine, for example. Sativex, which is a cannabinoid synthetic drug. Magnesium, 400 milligrams at nighttime. Magnesium as a vitamin is taken at nighttime. Quite often, people with MS take it in the morning and they feel even more drowsy and tired because magnesium tends to relax the muscle cells and you feel just relaxed. But that's okay for the nighttime, particularly if it reduces your spasms in the muscles. Now, MS hug is another painful experience. It's a tight band around the torso, squeezes, and it's so intense that people sometimes cry and they go to the emergency departments because they feel like they're having a heart attack. So be careful. So again, that responses to our antispasmodic and neuropathic painkillers. Spasticity-related pain, like when the stiffness and cramping is very intense, is because the legs are presenting with the increased tone. I call this a wooden gait. People can't bend their hips or knees, or they have certain position of the legs, like the leg is always bent. You can't extend the leg. So that's mainly because of the ongoing spasticity. And the danger thing is that it becomes a dangerous situation. A fracture, which is the fibers that connects the muscle to the bone, gets stiffened, and then it's impossible then to extend the limb. And it's difficult to care after people who's got this problem. So usually the passive active movements, some physiotherapy, is a good way of managing this problem. Dystonia pain, muscle blocking and twisting, some inappropriate posturing of the hands, legs. People have involuntary movements that goes into the spasms and they can't unlock their fist, for example, or the arm moves one or another direction. It's really painful experiences. So again, we manage that with chemicals, with medicine. Sometimes Botox injections may help if it is a constant and ongoing issue. So yes, just be mindful about this is important. Gentle movements, never going to hurt anybody, like yoga, Pilates, daily movement, walking, mobility, trying to keep the momentum and walk. It improves all these symptoms from dystonia to neuropathic pain and spasming, cramping, and spasticity. Sometimes people use capsaicin creams, non-steroidal anti-inflammatory creams. Try that. If there is some inflammation going on in the joints, it may help. Some people respond to capsaicin cream, which helps to reduce a bit of neuropathic pain experiences. TENS machine, transcutaneous electric stimulation, is a good one for lower back problems, for shoulder pains, for bone pains. It can be effective if you use that regularly. If you suffer from migraines and headaches, there's also TENS Lloyd's machine for headaches. So you push the electrode on your forehead to stimulate for minutes. And then if you do that regularly, it may diminish the frequency of the migraines. And then if the migraine attacks start, you can reduce the pain of the headache too. Alternative medicine, which is very ancient medicine. We call this alternative. Actually, this is how the whole medicine started. It's acupuncture, mindfulness. These approaches are very powerful for the pain management. Believe me or not, but that's proven to be effective. Okay, now let's talk about the mental health and mood. 50% of people with MS experience anxiety or depression. Sometimes it's reactive because of the new diagnosis, life change, upside down. Sometimes it's neurological, but always important. We can't ignore that. Common challenges are depression and anxiety, emotional changes, irritability. Sometimes people cry or laugh, giggle inappropriately. That's cerebral. That's coming from the brain dysregulation. And cognitive fog, mimicking mental health symptoms, is common. Some people experience extreme fatigue, brain fog, and that could potentially mimic depression or anxiety. So what helps is talking therapy, cognitive behavior therapy, acceptance commitment therapy, ACT, counseling, psychotherapy, all these powerful tools. Mindfulness reduces overthinking in your mind. It's really powerful tool, very, very old-fashioned. Comes from Buddhism, nothing to do with the religion at all. He's just learning how to experience the present moment without reacting, but responding to the environment and the stimulus. Movement, walking, stretching, yoga is number one that improves the mental health if you do that regularly and you stick to the regime and the program. Nutrition, again, omega-3, vitamin D3, gut-supported diets, anti-inflammatory diets, extra virgin, very high quality of the olive oil. I just visited Tuscany in Italy and I learned how the oils are being produced. So it's difficult to find a good quality of the olive oil in the grocery shop. You can't produce olive oil for £8 per bottle. One olive oil tree produces 2 bottles of olive oil. So imagine, the cost is high. And usually it costs from £20 to £40 per bottle, depends where you buy. Whether you live in the countries that produces the olive oil, so you're lucky because you can get cheaper from the olive oil farmers and makers. If you live in the Eastern European countries, there are some companies import the olive oil, but you need to make sure that it's 90% extra virgin, clean, clear, fresh, made in Italy, Greece, or Spain. These are countries that produces the best quality olive oil. So, or if you live in UK, for example, or America, so health shops that are selling the products of Europe, you may find a good quality of the extra virgin olive oil. You can also listen to the episode where I was talking to Frank Lickery about olive oil and benefits. It's a great product for longevity medicine, for healthy aging, for preventing having strokes, heart attacks, and all other cardiovascular issues and dementia. It's amazing natural elixir for wellness and long, healthy life. Now, peer support, if you have emotional problems, depression and anxiety, these are challenging situations that you require a bit of a talking therapy. Whether you're talking to yourself, you may do, or you are connected to other people and you talk your heart out. Your heart out needs to be spoken, cried out. If you want to sing, sing out. If you want to cry, cry out. The talking therapy, the peer support is very, very important. And just bear in mind that emotions that are not expressed get accumulated and then that causes a lot of problems. So if you want to look after yourself very well and you have accumulated emotions, cry it out, talk it out, walk it out, write it out, draw it out, sweat it out, or breathe it out. Okay, so expression gets you on a better journey, so you're not spiraling down, you're coming out of this spiral. Now, what the supplements could help you with your progressive MS? We discussed about omega-3, but if you're consuming a good quality extra virgin olive oil from Greece, Italy, or Spain, you're okay. But if you don't, consider omega-3 fish oil. It helps to compensate the omega-3s. With our current Western diet that's coming from US, you get a lot of omega-6, but less omega-3s. And to compensate that, it's useful to have extra, whether it's coming extra virgin olive oil or as a supplement, both works. Magnesium for spasms, as we discussed, leafy greens, pumpkin seeds full of magnesium. Zinc and selenium are other antioxidants. Is good for brain protection. It comes from lentils, eggs, basil nuts. And if you are anemic, that's another common reason why people feel so fatigued and exhausted. It improves the nerve function if you take some extra iron and potassium, particularly if you have deficiency. So nutrition advice for getting extra iron is tofu, sweet potatoes, bananas. So these are foods that you could consume and get extra support. If you are supplementing yourself, always check the level. I think it's important to keep an eye on the level. Too much of a good thing can be also harmful, so be mindful about this. Nutrition won't cure MS, as we know, but it can make your body much more resilient and healthy. Okay, I think it's time now. I always advocate for meditation and mindfulness, and I would like to provide you 6 to 8 minute guided meditation. Just to use that opportunity. If you listen up until the moment, I'm very grateful because you're getting all the benefits from this episode. You are going to be guided by me, and we're going to meditate together. So, use any cushion that you've got, any pillow. Maybe you're in bed, maybe you're sitting. Just find this comfortable position of your body. And when you're ready, if you wish, close your eyes. But if you don't want to close your eyes, you want to watch me, if you're watching me on YouTube or Spotify or many other platforms, keep your eyes open and see what I'm doing. But in the meantime, if you don't see me, close your eyes gently. And I would like you to invite to make a moment just for you. You don't need to do anything. You don't need to move. You don't need to fix anything. You simply need to be. It's a very short guided meditation based on the Yoga Nidra or yogic sleep. It's one of these powerful meditation branches that really helps to unwind and rest your brain. It's a powerful tool to rest your nervous system, calm fatigue, calm your nerves, and invite this sense of the wholeness, especially very, very helpful in progressive MS. So let's begin. Allow your hands to rest by your side, palms open. Take a slow breathe in through your nose and slowly and easy breathe out. And let's do that one more time. Take a slow breathe in. And as you exhale, slow it down. Inhaling calm, exhaling tension. Now breathe as you would normally breathe. And bring your attention to different parts of your body, one by one. As I name them, just feel them, but no movement is required. Starting with feeling your right hand, your right thumb, your right index finger, middle finger, ring finger, little finger, your palm, your back of your hand, your wrist, your forearm, your elbow, your upper arm, your right shoulder. Feel the entire whole right arm. Now let's move your attention to the left side, your left, your thumb, your index finger, your middle finger, ring finger, your little finger, your palm, your wrist, your forearm, your elbow, your upper arm, your shoulder. Now feel both arms at the same time, resting deeply. Now bring your attention to your head, back of your head, your upper back, your middle back, your lower back, your entire spine, moving to pelvis, your hips, Bring gentle awareness of your legs, starting with your right leg, your thigh, your knee, your calf, your shin, your ankle, your toes, your big toe, your fourth toe, your third toe, your second toe, your little toe, your entire right leg. Now move your awareness to the left thigh, your knee, your shin, your calf, your ankle, your toes, your big toe, your fourth toe, your third, and the second, and the first toe. Now bring your awareness to the entire body, from the top of your head to the toes. Now scan your face. Your jaw is relaxed and soft. Your face is relaxed and eyes are resting. Your forehead is flat, no wrinkles. Let the whole body feel held, feel supported, feel safe. Repeat to yourself gently, my body and mind is light. My breath is steady. I am safe. There's nothing I need to do. Or you may have your own words to yourself that I allow you to repeat to yourself. Let any sensation float. Let fatigue be met with compassion. You're not broken. You're not lost. You are a field of awareness, full of light, resilience, and rest. Now take a breath. Feel the ground beneath you. Gently start wiggling your fingers, your toes. And when you're ready, open your eyes, look around. Can you hear any sound around you? Can you see things? That was Yoga Nidra, a practice that can be done anytime, anywhere. And you could always come back and listen to the same track and be guided. It helps to unwind and rest and calm the nervous system and reduce the pain and restore your energy. So let's finalize this episode. If you are at the point where your MS is progressing and disease-modifying therapies are no longer being prescribed, I want to say you clearly, you are still treatable, you're still valuable, and you're still the whole. This phase of MS isn't about giving up. It's about shifting forward towards living better, towards living healthier, towards living full-on life with tools, with people around you, practices and wisdom that uplift and empower and inspire you to move forward. Your neurologist, nurse, therapist, or peer or friend or buddy isn't there to fix you. We are here to walk beside you and help you walk your own path with strength. For more support, head over to www.BeeWellwithMS or any charities, MS Society, MS Trust, MS Together, Shift MS, European MS platform, you'll find some guides, groups of people, reassurance that you're not doing this on your own. You're not alone at all. And if this episode resonates with you and you think you could share with anybody else that would benefit and get right help at the right time from this episode, so feel free to share, comment, and until next time, take care. Take care of your mind, body, and your spirit. You deserve to be well. So be well. Bye for now.